When a dying person stops eating, should we be putting a feeding tube in that person? My name is Duncan. I'm a nurse practitioner and an end-of-life coach. When a person is dying, it is natural and normal for them to stop eating and stop drinking. They lose that hunger sensation. They eventually lose the ability to swallow. And again, all of these things are a natural and normal part of the dying process. It's the way that the dying person's body is trying to tell them and communicate and tell everybody else that their body is shutting down and that food is no longer the need or priority. I think it can be really hard for a lot of families to watch as a loved one stops eating because in a lot of ways we don't just see food as survival, we see food as love and connection. But what's important to realize is that a dying person's body is shutting down, all the systems are shutting down, and it no longer requires nutrition to keep it going because that's not the overall goal at this point in time. And so what we can see happen when a feeding tube is placed into a dying person is we can see things like fluid overload, like abdominal pain and distension, reflux, we see nausea, we see vomiting. We can even see something called aspiration, where contents in the stomach basically reflux back up and they end up going into the lungs, and it can cause immediate respiratory or breathing distress, pneumonia, and even sudden death. The research shows that artificial nutrition and feeding does not prolong someone's life, nor does it add to any sort of quality of life at the end of life.